This is Headline Humboldt. I'm James Faulk. Thanks for joining us. We've spent the better part of a year in a kind of bubble, watching much of the country struggle with surging death rates and infections while we remained relatively safe. While changes in patient care and first response protocols made life more difficult for caregivers and those seeking aid by locking out loved ones out of the process, for example, by and large, we've been witnesses to the unfolding tragedy and barely a participant. Those days are behind us. We've all watched in horror the last 2 weeks as Granada Care Home first became ground zero for Humboldt County's most serious outbreak, and then as one by one, 6 residents there have died. In total, the county has had 15 COVID-related deaths so far. Again, we're faced with the juxtaposition of emotions. On the one hand, we're seeing more and more infections, more people getting seriously sick, and more people dying. But also this week, we received our first shipment of the Pfizer vaccine, which St. Joseph Hospital purchased special freezers to store. We'll have more on that process later, but the first recipients have received their initial dose, and so far, no major side effects have been locally reported. The deployment strategy developed by the CDC requires that initial priority be given to healthcare workers at risk of exposure and then those in residential care facilities that have proven to be so deadly. According to county officials, the federal government has partnered directly with pharmacies nationwide, including CVS and Walgreens, to distribute the vaccine to residents and staff at these long-term care facilities. That program is expected to roll out next week. But right now, as we wait for our own vaccinations, public health officials are frantically reminding all of us that although we have a vaccine, this is not the time to let down our guard. It'll take months for a vaccination to be available to everyone, and with the holidays just around the corner, people need to stay responsible and continue making hard choices. This most recent rash of infections arose primarily because people took risks during the Thanksgiving holiday and got together with family. To make the same mistake again and couple a new surge on top of an existing spike would seriously jeopardize the system's ability to care for the ill and save lives. For the interview tonight, we have Executive Director Lasara Firefox Allen from the Humboldt Center for Harm Reduction, or HACHR, which has been the subject of much debate in Eureka these past few months. City officials have worked to limit and ultimately eliminate their needle exchange services in Eureka. For some, it seems unthinkable to stack one public health crisis, the county's high rates of hepatitis C, on top of another in COVID-19. Yet some others believe that HACHR is actively encouraging drug use, and they demand that it be stopped. Hi, Lasara, are you there?
I am here.
Thanks for taking.
Nice to see you, James.
Yeah, thanks for taking the time out to come on the show again. We appreciate you.
Absolutely.
So,
pleasure to be here.
Let's talk a little bit about the situation that exists between the city of Eureka and HACHR. Basically, the city has to agree to allow you guys to operate within the city, and that has been currently revoked. Is that a correct summary?
That is correct. That's correct. Mm-hmm.
Now, what are they blaming this decision on? Why did they come to this, impasse?
So, I have been executive director for just almost 7 months now, 6.5 about, and in that time, it's been it's been a roller coaster actually, but we came to a point where we were negotiating with the city council members, and I ended up entering into negotiations, mediation with Miles Slattery as the representative of city council. Mm-hmm. And we came to an agreement that I believe Miles and I both thought was going to actually gain traction. I don't think either of us had it. I was certainly blindsided when it was not adopted. Mm-hmm. Literally blindsided. I was surprised. I was shocked. I was appalled when it was not adopted by the city council because we had adhered to everything that as we understood it, everything that had been requested by the city council. And so it was shocking to me when the mediation agreement was not basically ratified by the city council.
Now, so basically the mediation agreement would have had you guys set up and then follow a certain set of rules for how your center would operate. Is that correct?
Yes. Yes, absolutely. It included things like putting up a security fence around the 3rd Street location, going completely mobile from June 1st onward, and hiring an outside monitor to monitor our population and keep them to their, make sure that everyone was abiding by their agreements that they willingly undertake in order to receive services from HACHR.
It sure seems to an outside observer as if it didn't really matter what HACHR did, that the City Council had basically come to the end of its tether in relation to HACHR. Where does that leave you and your operations right now? I mean, obviously some of your clients are being impacted as we speak. Is that correct?
Absolutely. My syringe services program coordinator, Jasmine Guerra, has told me today that we have had an 80% reduction in just a few days.
Wow.
In services being administered to our population, which means that fewer people are getting Narcan, fewer people are getting medication-assisted treatment, fewer people are getting wound care treatment, fewer people are getting food and water. So it's across the board.
Yeah.
An extensive impact on our population.
I mean, it's common knowledge, and I'm not afraid to continue admitting it, but I was once a drug addict, and I understand, what the impact of that could be. But for people at home, a lot of these people are on the ragged edge, and when you talk about wound care, a lot of times their infection sites might be infected. They may have MRSA or staph infections that can potentially even prove fatal if they don't get the care they need.
Absolutely. Absolutely.
And then you didn't even mention hepatitis C and the diseases that can come from using dirty gear. But you found a little bit of a stopgap. Can you describe for us what you guys are doing in the meantime?
Yeah, we are allowed to do, according to our authorization with the state of California, with the California Department of Public Health, our authorization allows us to do home delivery and pickup, and during COVID, and that home delivery and pickup includes non-traditional housing such as tents, RVs, cars, etc. So we are doing non-traditional housing pickup and delivery, as well as traditional brick and mortar housing, as we have been doing since COVID began. That we will, if someone calls in or stops by the location and says, this is my location, and we set up a time for the appointment, that we will deliver to that location.
Now, you're doing this within the city of Eureka as well, is that right?
Outside the city of Eureka. We are not doing any services within the city of Eureka.
So how many clients would you estimate that you had who were within Eureka prior to this?
Oh, a vast number. The vast majority of our population is within Eureka city limits, and those are the folks who are currently not getting services.
Wow. In your statement that you had released last week, you said that in effect the City Council seemed to be reacting to the old relationship between HACHR and the city. There's a lot of history there. Can you sort of describe for us where you think that history went wrong, and why you think things are different now?
Well, I think it's interesting because people say that Brandy, the founder, Brandy Wilson, the founder of HACHR, was, they either say she was perfect or she was, reprehensible, and there's neither is true. I'm sure she was a human being doing her best to get traction for harm reduction in a community that had a lot of resistance. Mm-hmm. And Jessica is my mentor, has been an amazing inspiration to me, and during Jessica's time as executive director at HACHR, things were really quiet. I was employed under her as the HIV/HCV testing treatment coordinator, and things were very chill. Things seemed to be okay. And, when Jessica first became ED, she gave a report to the city manager. Sparks at the time was the city manager, and was never asked for anything further, thought she was in compliance with what was required since our certification and authorization was with the state. And then we come to find out months later, once I am in the ED seat, that the city feels like we were never in compliance because we were doing what was required by our authorization with the state, but not what was required by the ordinance of the city of Eureka. However, no one necessarily made that clear to Jessica, as I understand it.
Mhm.
And so, you know, I think everyone has done their best to abide. It's very challenging running a nonprofit organization. You get very busy, there's a lot going on, and if things are not being asked for, they don't necessarily always get delivered. And so uh, there's a level of, I think, I would say I don't think that there was ever any intentional flaunting of agreements or anything like that. I just think that things happen. And I think that everyone has literally done the best that they could to abide by what was thought to be the agreements that we were operating under. For the last 7 months, I have done everything that I could to abide by what was requested of me. And as I can tell you right now, it seems like no matter what I did, it was not going to be enough.
Yeah. So what's the next step for HACHR? Is there any kind of protest process that you can go through, or how are you guys going to move ahead even under this restriction?
I mean, honestly, right now, very much of our attention is being taken up with what can we do to make sure that we don't hit another major crisis for public health in our county. What we're doing right now is trying to stopgap measure the impact that is going to most assuredly come of this shutdown.
Mm-hmm. If people, for people who are watching, if they have need, where can people get clean gear if they are not coming to HACHR?
So the city, the county and Exchange NORCAP is doing hours on, I believe, Thursday, and they are expanding to Monday as well. I think they do Wednesday, Thursday, and they're expanding to Monday. So there are some limited syringe services in town. People have their preferences about where they want to go. And so it's hard. The other thing to take into consideration too is that HACHR offers a lot more than just syringe services. Sure. We offer overdose prevention, medication, and training. We offer medication-assisted treatment through Bright Heart Health, so people can get on Suboxone therapy within hours, literally, if they are ready to segue off of using the way that they've been using. If they want medication-assisted treatment, we have that option available. We have food, we have water, we have clean, dry socks and underwear. We have food, snack bars, Gatorade, aspirin. Blankets. There are a bunch of different services that are very basic that we offer out to our participants, and a lot of those are still available at the 3rd Street location.
So people can still come in and get some of those services. I mean, part of what is so I think psychologically beneficial about a program like HACHR is that people who are on the fringes can come in and feel like a human being for a little while. There's dignity and there's sympathy, and even though people would rather you not use, they're not in a judgmental or punitive stance toward them.
Harm reduction is about meeting people where they are. People have to want to change in order to change, and as much as we can show up to where people are at and support them to make the best choices that they possibly can given their circumstances, we're going to do that.
I'm almost out of time, but I wanted to ask you real quick, if people out there support your mission and what you guys are doing, how can they make themselves most effectively heard?
So you can find us on Facebook at HACHR 707, and you can make donations at our Facebook page. You can find us at HACHR707.org. You can also find us at our 3rd Street location, which is 1522 3rd Street. You can call us. I don't have our main line memorized, which is horrible, but I don't. But you can call us. You can drop by our location. You can find all of that information on our Facebook page or on our website. And yeah, we also continually need things like snack bars, Gatorade, blankets, all those things that we hand out. If you have any of those extras lying around, we'll take them.
Okay, we're out of time, but thank you, Lasara, for joining us. I appreciate what you do. Keep up the good fight, and have a nice weekend.
Thank you, James.
We'll be right back after the short break.
Dell'Arte International and KEET-TV bring you a local holiday special, Hansel and Gretel. The brother and sister walk through the scary forest and meet a wacky witch who has more than candy to tempt hungry kids. This original production has acrobatics, nasty spells, and chocolate Twinkies that are all mixed up for you to make an offbeat holiday treat. Watch Dell'Arte's Hansel and Gretel.
On Monday morning, the first doses of the new Pfizer COVID vaccine arrived in Humboldt County. In short order, the first patients received their dosages. In that first batch, 975 doses were delivered, and officials say that more is scheduled to come as soon as next week. In the following weeks, a new vaccine from Moderna is expected to join the fight here and elsewhere after it received an emergency use authorization from the FDA tonight. Here's more.
Hi, my name is Yolanda Stevens. I am Employee Health Coordinator of Mad River Community Hospital, as well as the Occupational Health Supervisor. I am very proud to give this vaccine today to be a part of Humboldt County Mad River Hospital, one of the first ones to get this injection. I've been here for over 20 years and very, very proud to have this vaccine and be a part of this commitment.
I'm Dr. Ian Hoffman, here today at Mad River Hospital, here with David Neal, who's the Chief Nursing Officer for the hospital, and we're here today giving the very first COVID vaccine in Humboldt County. We just want to remind everyone this is a very safe vaccine. It's been through its clinical trials. We know that it's safe. We're giving it to our own healthcare workers first because we feel so strongly that this is safe, and it's also very effective, and we know that this is going to be a really important tool for stopping the spread of COVID-19. So thank you, David. Thank you, Mad River Hospital. And thank you, Humboldt County, for getting your vaccine.
Yep, thank you.
Humboldt County Public Health Officer Ian Hoffman, who you just saw, today described how the vaccination process has unfolded after lengthy consultation with area hospitals. Hoffman said the county has now received 2 allotments of 975 doses and expects to receive 1 delivery a week for the immediate future, barring any reallocations from state officials. The guiding principles in distributing the dosages are equity, transparency, and safety, he said, and thus far the system has worked well.
I can say roughly about 250 vaccines have been given so far this week, which is pretty amazing. Everyone's working really hard to get these vaccines out quickly. As to the process for which the line forms, there's been an immense amount of discussion up to this point. We've only just started to get through that first part of the discussion, which was to prioritize within Phase 1A, and there are 3 tiers there, Tier 1, Tier 2, and Tier 3. So we're currently on Tier 1, which includes hospital staff, skilled nursing facilities, EMS, and dialysis. So we're working to get through those. The hospitals and healthcare providers who were allocated their share of the vaccine from public health based on months of research of who their employees are and what category they fit into. They got their allocations this week, and then from there, public health has instructed them to follow the tier guidance, and it's up to those individuals within those institutions and organizations to follow that guidance.
State Senator Mike McGuire held a town hall meeting on Thursday on the state of the Golden State's ongoing battle with COVID-19. While there is relief clearly on the way, the approaching holidays and current infection numbers are a warning to everyone that we are not out of the woods just yet.
We are all living in challenging times right now. While there is light at the end of the tunnel because of the vaccines, the next 2 to 3 months here in the United States and right here at home in California, it's going to be the worst. They're going to be the worst of the pandemic. The impact of holiday gatherings is expediting the rate of spread of the coronavirus in our communities. Several regions of this state, including counties in the North Bay area, have seen ICU capacities enter surge mode, and other Northern California counties are getting close to capacity. We're seeing record numbers of infections each and every day in the state of California. A soaring death rate has taken hold across the United States. That said, as Californians and as Americans, we need to hold strong. We will get through this, but we need each other more than ever.
McGuire was joined at the meeting by Dr. Timothy Brewer from the UCLA School of Medicine, who described in detail how a new medical technology was brought to bear with both the Pfizer and Moderna vaccines. For the first time, experts deployed a vaccine using messenger RNA, or mRNA, which holds great promise for the future.
So we now have 2 vaccines that are coming out. One is the Pfizer vaccine, which has already been authorized by the Food and Drug Administration through what's called an emergency use authorization, or an EUA. And the second is the Moderna vaccine, which was recommended by the panel today and will likely be authorized in the next few days. Both of these vaccines rely on messenger RNA. So this is a new technology. We have never had an mRNA vaccine in humans before. mRNA vaccines are genetic codes. They're just little signals that, when injected into the body, enter into the cells, and then the cells manufacture the protein from that code. In this case, the spike protein for the SARS-CoV-2 coronavirus. What happens then is the immune system recognizes that protein as a foreign invader, and it generates a protective response. And that's part of why you get the side effects from a vaccine. And we'll talk about those in 1 second. But more importantly, what it does is it primes the immune system so that if you get exposed to the SARS-CoV-2 virus, the immune system is ready to roll, generate a rapid response, and protect you from getting sick. And based on trials, both vaccines offer about 95% efficacy in protecting against serious disease. So that's actually terrific news. What we don't know is we don't know if the vaccines protect against infection. And so that's why it's going to be so important while we roll out these vaccines that we continue to do our masking in public places, we maintain our social distancing, we stay home when we're sick, and we use our hand hygiene, because we don't know yet whether these vaccines will actually interrupt transmission, but great news that they do protect against serious disease.
Also at the meeting was Dr. Matt Willis, Marin County Public Health Officer, who described the conflicting emotions involved in receiving a vaccine the same day that so many are struggling in his hospital to stay alive.
I think the best way to summarize where we are in Marin and across the region is to describe my day yesterday, which began at the Emergency Operations Center, like most of my days do since the beginning of this pandemic, 9 months ago, with the arrival of the best holiday gift we could imagine, which was the box of 1,950 doses of the Pfizer vaccine. We immediately deployed our teams out to our 3 hospitals to distribute that vaccine and join them in a celebratory event where the first employees, emergency room doctors, emergency room staff were actually vaccinated right then and there. Obviously, that celebratory atmosphere was tempered by the fact that in that very hospital, people upstairs in the ICU, on ventilators, many fighting for their lives, we're also seeing record surges. So that same day that we had the vaccine, we also had the greatest number of cases in one day we've ever seen. If I have any concerns right now, is that the community right now might not recognize how much control we have over this right now. It may feel like we're helpless, we're seeing surges everywhere, but the fact is it is in our hands. If we were able to interrupt transmission in the community as it's occurring every day, we would actually be able to start reducing within a week, within 2 weeks, within 3 weeks, we start seeing hospitalization rates go down. Our ICUs would start relaxing in terms of their capacity. That's what we need. And that's why I think the most important issue for me as a health officer is to try to help our whole community understand how much control we actually have over this. And it's interventions that we've been talking about for a long time.
Changing gears here just a bit, we've all made sacrifices this year in order to stay healthy. Events, plans, and goals have all been dropped if they pose too great a risk. Whether it's not visiting close family or canceling the annual Christmas party, traditions have repeatedly fallen by the wayside. But this year, Dell'Arte and KEET-TV have partnered to bring you a 2020 holiday treat. Hansel and Gretel, a recorded live performance that's rife with good humor, social satire of the sort only Dell'Arte can deliver, and holiday cheer. Saturday at 6 p.m., Tuesday at 9 p.m., you can watch this special performance on KEET HD. Change into your cuddly clothes, make a hot drink, and gather around the mulberry bush or whatever. Enjoy the holiday entertainment. Here's a sneak peek.
It seemed just to fit the moment we are in time. In terms of food scarcity, in terms of, a convergence of crises from social and racial justice to a pandemic which has reduced our ability to even gather in the theater. And it is more about, how children are actually pretty wise. In their own, they have an innate wisdom that is often not listened to. And what we really tried to do when we started writing was to lay out a point of view that the wisdom of children should be heard. So in this moment of really profound uncertainty, what we really wanted to do is to engage our community as we have done, and understanding that there are now limitations. We can't gather live in the theater at this moment. But what we can do is partner with folks like you, KEET, to be able to bring the work to as many people as we can for free at the holidays.
Eureka Mayor Susan Seaman in her weekly brief today said that the economic impacts and budgetary impacts from COVID-19 have not been as bad as the city originally forecasted.
We've been pleasantly surprised that economic indicators like unemployment numbers are lower than we expected, and sales tax revenue is higher. For those who are struggling, this may be a small consolation, but it does allow the city to start to think about additional ways to support those who need help. And even though we're in the purple tier, Humboldt County still has the 4th lowest number of cases per 100,000 of 50 counties in the state. Ongoing communication and direction from our public health officer and the work done by the COVID Economic Resiliency Consortium has created the foundation to face this with the fewest cases possible. But ultimately, it takes everybody's participation. So thank you to those of you out there who, despite COVID fatigue, and we're all feeling it, are still following the guidelines that we all know will help us get through this.
That's all the time we have for this Friday night. We won't be here next Friday as our staff will all be busy celebrating the holiday at home, such as it is. In the meantime, stay tuned, stay informed, and from everyone here, happy holidays.